to this conversation, Caroline Lee. Can I start by asking you, home care is the cornerstone of the government's strategy for protecting and looking after older people for the future. What is your view of home care and the sector's readiness for this?
This is a new era. Home care now needs to become, like the old days, the low care. It needs to have that professional care assessment focus, which it hasn't had to rely on in the past. Now the acuity requirements of people, even in home care, need a clinician to do an initial assessment, need the expertise of professionals. The standards with 1 November require that of them now as well. The expertise of the person going in the home now needs to understand what those clinical contributions are that therefore require that extra support. So home care now needs to see that it's in a transformation stage, that it is no longer just providing services and billing. It now has to embrace the clinical expectations of the market, of the older person who wants the help because their medical condition now requires that. And so the market now needs to recognise that that requires much more professional software content. They have to have the assessments in there that a clinician could go in and fill out to come up with a plan. No matter how minimal the care plan is, it still requires that initial proper clinical assessment, without forgetting that this is in a person's home, and that's where the primary care health professionals come into it. Just like an acute care nurse focuses on acute care when a person's in hospital, residential care nurses have to focus on the combination of a clinical and lifestyle approach to care because they're living there, which is a whole specialty in itself.